Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I'm currently completing my placement with the Organization for a Safer Space. Today, I will be talking about reactive attachment disorder. In this video, we'll first look at what reactive attachment disorder is. We'll then look at the risk factors and causes, symptoms, effects, treatment, and lastly, we'll look at some coping strategies. The Diagnostic and Statistical Manual 5th edition, or the DSM-5, defines reactive attachment disorder as a condition associated with trauma and stressors during early childhood, which is attributed to social neglect and maltreatment. Those affected with reactive attachment disorder can experience the following: have trouble developing attachment to other people, especially their caretakers, feel scared or anxious around their caretakers, struggle managing their emotions and have a lower ability to have positive emotions, reject physical or emotional closeness, and are difficult to console and discipline. Risk factors. Children are more likely to have reactive attachment disorder if they have experienced any of the following: several different parental figures, such as several foster care circumstances, forced separation from primary caregivers with whom a person has an emotional bond with, bereavement in the early years, having parental figures who do not attempt an emotional bond, and being in an institution such as an orphanage with no caring parental figure. Causes. Evidence proposes the following causes for reactive attachment disorder: abuse or neglect, causing the child to feel abandoned. Neglect can occur when caregivers face pressures such as poverty, substance misuse, inaccessible childcare, mental health disorders, and incarceration. Other causes of reactive attachment disorder include food insecurity, leading to unmet needs, lack of safety, leading to a child feeling unsafe, lack of hygiene, such as a baby's diaper not being changed regularly, and inconsistent caregiving, including needs only being met sometimes. Symptoms. According to the DSM-5, the diagnosis of reactive attachment disorder include the following criteria: being emotionally withdrawn and inhibited, and having difficulty seeking comfort during times of distress. A history of insufficient care, including one of the following: abuse, neglect, or maltreatment, multiple caregivers leading to a destabilized environment, living in unusual settings that limit the development of selective attachments. Other criteria include experience of at least two of the preceding: negative affect, unfounded irritability, fear, and sadness. The child must not meet the criteria for autism spectrum disorder. The child must be at least 9 months old, and the symptoms appear before the age of 5. Effects. If left untreated, the symptoms of reactive attachment disorder can lead to complications in childhood, adolescence, and adulthood. Complications can manifest as developmental delays, risk-taking, eating disorders, other mental health conditions such as anxiety, depression, anger management issues, and post-traumatic stress disorder. Substance abuse, difficulties learning or behaving in school, and relationship issues. Treatment. Reactive attachment disorder focuses on developing or repairing healthy emotional relationships between children and their caregivers. The treatment includes education and therapy. Parent or caregiver education includes learning positive behavioral management techniques, as well as learning how to identify triggers, avoid triggers, soothe their children, and how to understand and react to nonverbal communication. Psychotherapies can be beneficial as well, as they can be used to educate the child and parent to develop healthy emotional skills and decrease negative behavior that hinder bonding. Similarly, family therapy focuses on improving interactions between a child and their caregiver. Lastly, social skills intervention educates a child on how to act appropriately with other children. Coping strategies. To develop a healthy connection with a child with reactive attachment disorder, a caregiver can educate themselves on child development, including how to appropriately interact with the child and decrease their child's stress. Provide positive attention by spending quality time with the child. Engage in activities such as play, reading, or cuddling to create a relationship with love and trust. And nurture the child and meet their needs. Feel free to check out the organization For a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.